Hello, welcome to my channel. So today we are going to talk about the ML Breaks recalls November 2023 from the LEX exams November 2023. Okay, so we are going to cover, for this one, we are just going to cover the practical part, leaving out the theory part. Okay, so I decided, okay, let's do the practical part at least. We cover the practical part. So you have to know that this walkthrough may vary from the actual exam, as it's not as it's just a testimonial. It's not intended or claimed to represent the same actual exam. Okay, so you can pause and go through the disclaimer. Okay, then of course we were initially supposed to cover the theory and the practical part, but we are just going to cover the practical part alone. Okay, but just for recap, we have to know that the total MCQs might be given still remains 150 to 200, and it contains surgery section, obstetric and gynecology, internal medicine, and also pediatric section, and the mental health and psychiatry section. That's the thing about the exam. Okay, then after you have done all the MCQs, then you reach after you're done with the MCQs, then you go to the practicals. Okay, so practicals again, they depending on they differ depending on how the examiners have set up the examination itself. Okay, but specifically this is the one for medical licentiates, where the first station was saying you will receive a female of 30 years with history of 3 years of PVB, had to get a transfusion 2 times last year. So first get the history from the patient, then differential diagnosis. So let's say we are querying endometriosis here. Okay, then after that they ask you about the differential diagnosis, and if you finish all these, they may even put more questions. So this question was about the PMB, postmenopausal bleeding. Okay, so that's one of the theory, one of the practical questions. Okay, then the other practical question was a picture of a Foley's catheter. So most of us have seen a picture of the Foley's catheter before, and of course you ask to identify, you have to identify it, because if at all it's a 2-way, 3-way, or what kind of the catheter it is. Okay, then you state the types. Okay, then you describe how to perform the procedure. Okay, these are some of the things people do almost every day in the wards. Okay, even in OPD or resus. Okay, so this was a good question. Then the next question is picture of a IV cannula, another good exam setup question. So they ask you to identify the indications, then also describe how to perform the procedure. So then in addition to the IV cannula, is that you may even be asked to name the colors and their sizes. So okay, maybe say start from 24G, then you even go to 14G. Okay, you mention the size and also the color. At least these are some of the very good practical questions. Okay, and the other station 3 says respiratory exam. It was about the respiratory exam, where there was a case scenario and the patient had history of smoking, who came with complaints of shortness of breath. So the first question was examine the patient. So of course they wanted you to do a respiratory exam. Then after that, you have to give the diagnosis and also the differential diagnosis. And the way the exam is, if you are even done with this, they may even put more questions on top of the ones we have managed to put. Okay, so that's the end of station 3. Then of course I'm not decided giving out answers, So so for this station 4, this demonstrate how to do lumbar puncture. Then after demonstrating, question follows, indications and contraindications. Okay, it's one of the best questions you might be asked if you have been on the ward, if you've been in theater, of course, where when they give spinal anesthesia, you have been observing what they do, indications, contraindications, and even complications you might be asked. Okay, so and you have to be specific. If you say, okay, low platelets, okay, how much is low platelets, or thrombocytopenia, how much do we say we can't do lumbar puncture here on the contraindications? Okay. Then the other question is station 5, where it was an unmanned question, where there was just a chest X-ray. Okay. Then one of the findings was that there was a left middle lobe homogeneous opacity, and the liver seemed elevated. Okay. So just imagine that the X-ray oku. Then describe what you see. Then after you describe what you see, what is your diagnosis and your differential diagnosis. So make sure you go through how to read a chest X-ray. So how to read a chest X-ray. Okay. Which of course is one of the most, again, most of the things people do daily on the wards. Then the other question, station 6, is retained placenta, where you get to define and demonstrate and describe how to perform a manual removal of the placenta on a mannequin. So this was also one of the easiest exam questions, because people, almost everyone have done this before, but the only thing is the fear when you are being examined. That's the only thing which can get in your way of doing things. Okay. Then station 7, of course, was a resting station. Then station 8, there was also another chest X-ray on a case of an HIV 8-month-old infant, and there was also some further questions from the examiner, and you also asked to describe what you see on the chest X-ray and what the person saw, depending on since we don't have the actual X-ray. So there was some bilateral mirror pattern. Then after that, then you asked the investigations, then the differential diagnosis, the diagnosis, and the management. Then you have to know that when you are told to read a chest X-ray, you have to follow the same your techniques, your demographics, your techniques, then the ABC's approach. Okay. Then unless the examiner just tell you to say, okay, just tell me the thing, the most typical thing there. Okay. That's only when you skip those things. But otherwise, if an exam setup, start with those, and they won't even take you more than 3 minutes or more than 5 minutes just reading the Excel. No. Okay, station 9, it was a picture of an infusion pump or syringe pump. So describe what you see, uses, advantages, and also disadvantages. Okay. So if you are wondering about the pictures, don't worry about the pictures. The reason why I didn't put the pictures is because almost everyone have seen this, and if you haven't, you can even just Google the same instruments they were bringing. But I just said, okay, so since this is more of a walkthrough kind of tutorial, so it's fine even if I don't put a picture, because it's not supposed to represent the actual pictures. So anyone can just type how the infusion pump looks like. Then of course they read about the uses, advantages, and of course the disadvantages as well. Okay. Then picture of a child with Down syndrome. I am sure everyone has seen those. Okay. Then brief presenting complaints given. Okay. Then you ask to counsel the mother. So it's more of a counseling someone who has a Down syndrome, who has a child with Down syndrome. Okay, then after done counseling, you have to give possible complications to expect and answer any over questions or concerns. Okay, so this is more of a counseling question. So counseling questions, there are a lot of counseling questions. You can counsel someone on, or you can break bad news. You can counsel someone who's going for OT. You can counsel someone who's going maybe for who has come from theater, maybe explain what went on and forth. Okay, those are some of the things. You can even explain a condition, like explaining diabetes. You have removing uh, implants like Jadeo. Okay, and those are some of the things, uh, practical things you might be asked on. Okay, then picture of thyroid mass, which is of course a goiter. Then take a focused history. Then further questions from the examiner. You get after you take the history, then you have further questions from the examiner. So about investigations, post-book complications, and differential diagnosis. Okay, those are some of the things that was in the previous exam. Okay, then another question was a patient present with icterus. Take a focused history, then diagnosis, and offer differential diagnosis. So most people, what I've seen them on they have to take focused history. They even just go to, okay, when did the icterus start? Like, when you're taking history, of course, there's the demographics. The demographics go to the presenting complaint, the history of presenting complaint, the review of systems, the past medical history, drug history. That's the format you're supposed to follow, but you ask about things related to the condition you have been given. On past medical history, you don't necessarily have to ask about DM, epilepsy, asthma, TB, like, just ask about things which can present with icterus. Okay, maybe does this patient have any condition of the biliary tree, like maybe do they apart from that, do they have any pancreatic cancer? Apart from that, have they had any cholecystitis? Okay, apart from that, is there any hemochromatosis? Like you ask questions that has to do with what you have been given, and even the past medical history should tally with the condition you have been given. Don't just ask anyhow. Okay. Then section 13, counsel a woman on post-laparotomy, and the differential is the diagnosis was for which was a post-lap, who went in for rhabdomyopathic. Okay, then the blood loss was 1,500 mils, and the left-sided fallopian tube and ovary were removed, and the right sided had signs of adhesions. So just cancel a woman post-lap. So of course, like I said, you have to mention why she went in theater. Okay, the findings, even the blood loss, complications which she might expect. Okay, those post-op complications. Okay, and of course, you have to address her concerns as well. That was the end of the practical exam for medical licentiates. Then for the 3 stations for clinical officer generals for the 2023 November Lex, there was 3 stations, of course. Station 1 was an hemogram for pancytopenia, and you asked about the causes and the management. So this was one of the straightforward things, but the thing is, you have to know the hemogram, and you have to know the differences between male and female, even some age groups. Okay. Then station 2 was of course about the famous suturing. So suturing has been coming. I think it even came in the first March 2023, November 2023. Like suturing is a skill for COs and of course for doctors and MLs as well. But not everyone is conversant with doing the suturing techniques. So the best way to learn suturing is not necessarily to stick around doing nothing. You have to at least be hands-on. You learn, you even do it on patients. Okay, so that at least you don't necessarily go there to start shivering in front of the examiner. Okay, it's just suturing. Okay, then the other station, which was the last station, is hydrocephalus, where you ask about the definition, the CSF flow, the causes, and the management. Okay, you can even be asked what you see on the MRI or CT scan in someone with hydrocephalus. Okay, even classification, when you are talking about the causes, you don't necessarily have to just mention them anyhow. You can classify them, then you mention how you classify, then you mention underneath. Even in the other question I forgot to mention was on icterus. Okay, so let's say they ask you, maybe they are specific and they say, okay, it's obstructive jaundice. Okay, mention the causes of obstructive jaundice. Then of course you have to classify them. Then you even mention underneath the classifications what are you talking about. Okay, just be mindful of what topic, what course, and how they ask questions in it, in that course. If you're dealing with surgery, of course, most of the questions are classified. If it's complication, find that the complications are classified: early, late, intermediate. Okay, just be mindful of what you are dealing with. Okay, even lumbar puncture, I ask the indications for lumbar puncture. Of course, they are classified to therapeutic and diagnostic, so don't forget that. Otherwise, that's the end of the exam for both MLs and COs. And thank you for watching. This is the end of also the tutorial. I just decided to first start with a practical exam, since the MCQs were not enough. So I just ended up, okay, let me just make the one for the walkthrough for the practical. Okay, thank you for watching once again. If you haven't subscribed, please subscribe, like, and share or comment. And see you on the next tutorial.